And I thank everyone for joining this webinar today. We are delighted to host this exciting topic on redefining the future of care think tank, which is building connected, intelligent, and preventive health ecosystems for a thriving 2030. Right? It's an important topic, and it's in front of everybody's mind as the industry evolves through different transformations. My name is Anantharaman, and I'm the Research Director for Life Sciences at Frost Sullivan. And I will be the moderator today. And as well as I will give you some insights on this topic. And, as Julieta mentioned, you can submit your questions, and then we will try and take them post the webinar. And today's webinar will also be recorded, and you can access it on demand by visiting frost.com. Right? We have an exciting panel today. And I'm impressed with their background and the work they have done. And we'll be talking about some of their expertise and also their understanding on what are some of the trends that will drive the future of healthcare. So let's take a moment to introduce today's presenters. I will start with Frost & Sullivan team. Over to you, Sagar, for a quick introduction about yourself.
Thanks, Anant. Hello, everyone. I'm Sagar Mukhekar. I work with Frost & Sullivan in their healthcare and life sciences team, and I majorly work in the healthcare IT and digital health area. So I will pass it to Utkarsha, who has joined us. Thank you.
Yeah, sure. Thank you, Sagar. Thank you, Anand. Hi, I'm Utkarsha. I worked in the Frost team in our MedTech division, and I primarily focused on MedTech technologies for patient monitoring and other connected devices. That's a brief about me.
Thanks, Utkarsha. And yeah, thank you very much. And let's now go with the panel team over here. We have two panel members from Mphasis, Ijaz, who is the CTO for Healthcare Vertical, and Timothy, who is the Vice President for Solutions at Mphasis. And I request Ijaz and team to introduce themselves and also what their organization and the products and services that they provide in this area. Over to you, Ijaz and Tim.
Thank you, Anand. My name is Ijaz Ahmed. I'm the Vice President and Chief Technology Officer for Healthcare and Life Sciences, representing Mphasis. Mphasis is a global IT company founded in 1998. At Mphasis, we are serving healthcare not only from the provider side, but also in the payer and life sciences area. We've been utilizing AI and transforming healthcare for the future, and we're very excited about the future of the healthcare industry. So we bring the entire healthcare ecosystem and have a lot of assets and platforms around the healthcare industry. I let Tim Smith, who's my partner in crime here, to introduce himself and add more to it. Thank you. And Tim, over to you.
Yeah, thanks, Ijaz. Tim Smith. I'm, as was mentioned, I'm the Vice President of Solutions with Mphasis. And the primary goal of the solutions areas we bring, again, in the healthcare space is across the board, from providers to payers to life sciences. And so we're able to bring the engineering and design and technology resources that are in the industry, as well as within Mphasis and other organizations, to build solutions that work across the board. And a lot of what we'll talk about today in this discussion has to do with sort of interoperability, new devices, how those work together, data, et cetera. And so we work to bring these new technologies to serve the requirements that we think will be needed through 2030. So glad to be on the panel. Thank you.
Yeah. Thanks, Ijaz and Tim. Excited to have you here. And then we have Alberto Sana, who's the Director at Center for Advanced Technology in Health and Wellbeing at Ospedale San Raffaele in Milan, Italy. Over to you, Alberto.
Thank you. So being the director of a research center, I'm an engineer by background. As I said, being a director in a research center, I work in the future since a lifetime. So I started 30 years ago, and I founded this research center, and we run the future of healthcare since time. So we understand the time that innovation takes to go to the market. And we created a holistic approach to healthcare. So we have 3 research lines. One is the hospital of the future, life of the future, and city of the future. And we run all these experiments of new technology, new systems in our living lab of a smart city that we have here in Milan, where we have all the premises of a city, of an hospital, of a research center, and we use this as a living lab to inject innovation and to test the sustainability of such innovations.
Thank you. Thank you, Alberto. And finally, we have Rajiv Mahale, who's the Chief Product and Business Development Officer at Cedargate. Over to you, Raj.
Hi, thank you so much, and really thank you for having me. Cedargate Technologies is an enterprise platform. We have data and analytics and AI to help identify opportunities. We have opportunities to put those into workflow so that physicians, providers, and self-funded employers and payers can actually put that at the point of care. And then we also have something unique, payment, which also alters the payment models. And if you can provide the data at the right time within workflow with the right payment model, you can really transform the delivery network and really change as we kind of migrate from this fee-for-service system to more of a value-based care system. I've been with Cedargate for 10 years as the Chief Product Officer and BD Officer, and we do offer that technology across both the providers or the providers, the payer, and the self-funded market. So really thank you for being here.
Thanks, Raj. Fantastic. Now, as we go through the presentation, we will not just be discussing about the trends, but also taking the experiences and perspectives from our esteemed panel to comment on some of these opportunities. So let's start with the presentation, right? So as we all know that, healthcare, there are a lot of challenges faced by the healthcare industry across the world. And these very challenges are driving the need for transformation. For example, if you look at the business and strategy of healthcare providers now, the outpatient procedures are increasing, while at the same time, the inpatient volume is coming down, right? And then the demand for healthcare services from aging population and also the patient expectation from consumerism is also growing, throwing up various challenges to the healthcare providers. And also there is a shift towards the value-based care, which is forcing the providers to kind of reimagine their strategy and then work along to address the requirements that are being thrown upon them. And then if you look at technology, most hospitals do not have a right set of data or technology acquisition and implementation strategy, right? And that's, again, an area which needs to be addressed. And then cybersecurity has also become a challenge as digital adoption is growing across. And then interconnected systems are lacking. So that's some of the challenges which from a technology perspective, the healthcare providers are facing. And then if you look at finance, and most hospitals, not just in the US, but across the world, are facing negative operating margins. And then these increasing operating costs are hindering the profit margins of these hospitals. And there are also significant delays that occur between the service delivery as well as the payment. Now, those three are some of the major challenges. And if you also look at the human resources aspect now, in terms of physicians and nurse burnout, this has been increasing, and this trend we've been seeing post-COVID-19, and this can threaten to kind of destabilize the hospital functioning, right? And then there are staffing shortages which are adding to the problem. And as per estimates, there could be a shortage of over 100,000 physicians in the US by 2030, right? And also the healthcare providers are facing competition from other type of players. For example, the growth of retail health sites that has led to the acquisition of patients by the retail health side, which is becoming a challenge for the healthcare providers. And also there is a shift of some of the surgical procedures to ambulatory surgery centers, which has reduced the revenue lines for the hospitals. And moreover, these new players offer direct-to-consumer virtual visits, urgent care, and retail health. So all these are kind of adding up to the competition which the healthcare sector is facing. And also there are sustainability requirements where hospitals are moving towards net zero, which has led to their need to reduce the environmental footprint. So with that, I will transition and invite Sagar to talk a little about healthcare infrastructure decentralization that's happening from hospital to people, and also talk about smart hospitals. Over to you, Sagar.
Thank you, Anand. Hello, everyone. So in today's session, I'll highlight two big shifts in healthcare we are tracking closely: the decentralization of healthcare delivery and the rise of smart hospitals. So together, these represent how healthcare will evolve by 2030. So as Anand briefly discussed, we can see that healthcare is at an inflection point right now. So on one hand, hospitals face severe operational, clinical, and financial pressures, while on the other hand, the technology, new business models, changing patient expectations are really opening a path towards more connected, decentralized, and intelligent care. So as you can see on this slide, traditionally, hospitals have been the primary center of care, but that model is no longer sustainable. Overall costs are rising, capacity is stretched, patients are increasingly expecting care to meet them where they are located, like in retail settings, in their homes, or through digital platforms. So by 2030, we expect a hub and spoke model of healthcare infrastructure that will really take shape here, where the hospital will remain the hub, but instead of being the only point of delivery, it will orchestrate the care across distributed ecosystem. So in this ecosystem, retail clinics will become access points for the basic and urgent care. Hospital at home programs will expand care into acute care management, while virtual care platforms will really enable the monitoring and consultations at scale. So, when we talk about this shift for providers, this will really mean the fundamental shift in strategy. So, when we think about this, the question is not about how do we run our hospital better, but it will be about how do we extend our hospital beyond its walls. So when we talk about this shift, for technology leaders, the backbone is really interoperability, cloud native platforms, as well as cyber security, to ensure that the data is flowing safely across this ecosystem, and it will enable for patients, it will enable faster, more convenient, and more preventive care. So the opportunity is definitely immense, with better access, lower cost, and improved patient experience. But the challenge is also real, like coordinating the fragmented set of players in this ecosystem, that too with seamless transition. So that is the biggest challenge in front of stakeholders. So as care moving beyond the hospital walls into retail, home, and virtual settings, the natural question becomes is like, what happens to the hospital itself, and how does these hospitals evolve in this new ecosystem? And that brings me to the second big shift, the rise of smart hospitals. So while healthcare is decentralizing, hospitals themselves are also transforming. Today many hospitals are digitized, with EHRs and some degree of automation, but by 2030, smart hospital will go far beyond digitization. It will basically form an intelligent ecosystem there. Smart hospitals will use AI, IoT, digital twins to make operations predictive rather than reactive. Just imagine that being able to simulate patient flow across an entire hospital before a crisis happens, or using IoT sensors to really optimize bed availability or infection control in real time. So there will be role of robotics, where it will automate logistics and even surgical procedures. AR and VR will also came into play, where they will transform both training and patient experience. So importantly, the smart hospital of 2030 will not exist in isolation, but it will be a command center that connects with home care, retail clinics, virtual care platforms. And this will be the critical link between decentralization and smart hospital. So the hospital will no longer be just a building, but an intelligence layer of connected health ecosystems. And again, as Anant mentioned, there is another dimension to this, which is about sustainability and resilience. So hospital consume huge amounts of energy and resources. So by 2030, smart hospitals will embed green infrastructure, energy optimization, as well as they will focus on climate resilient designs as a part of their transformation into smart facilities. So when we think about smart hospital, it is not just about technology for technology's sake, but it is about building a predictive, sustainable, and connected platform that really anchor the healthcare system of the future. So to sum up this, decentralization and smart hospitals are two sides of the same coin. One is about shifting care closer to the patient, and the other is making the hospital more intelligent and connected. So together, they will really redefine what healthcare infrastructure will look like by 2030. So thanks, Anant.
Thanks, Sagar. I think those are all important points, and it's an important topic on how hospitals and care delivery are evolving. And we will also have the panel talk about their perspectives on this later. Now I'd like Utkarsha to talk about how AI is enhancing remote patient monitoring technologies to enable care at home, as well as in terms of providing preventive care.
Thank you, Anand. So as Sagar just mentioned, that hospitals are getting smarter and care is also getting decentralized. So a bunch of new technologies are emerging in the RPM sector. And with the help of various AI-based algorithms, they're monitoring various vital signs, maybe it's respiration or heart rate or overall medication management. So coupled with the various patient or disease management platforms, these solutions are enabling preventive care. And to this, AI is a very central and important parameter. So the first thing they're benefiting is by providing the overall awareness and patient engagement, and shifting the care or bringing in more control over their own care in the hands of the patients. So these technologies are also like providing regular monitoring, and this is like increasing the overall follow-up as well as supporting in care coordination. So as these technologies are easily getting integrated into EHR systems or hospital information systems, so this is enabling hospital to provide a better care coordination. Apart from that, with the help of these AI-based algorithms, and a lot of data is also collected using various remote monitoring technologies, clinicians can easily provide a data-driven decision making and also provide a more personalized care. Also, a lot of US FDA approved AI-based predictive algorithms are available, and these are also like enabling providing predictive insights. And all these solutions in turn are like helping in reducing the emergency hospital visits, reducing hospitalization, and overall reducing the risk of diseases. So this is supporting in reducing the overall financial burden of, and also enabling clinicians for a better operational efficiency and helping hospitals to get smarter. So this is also helping like to provide a more proactive care and a more personalized care. And in the future, as we can see, care is shifting towards more preventive care from the current reactive model. So AI-based connected technologies are supporting this, and this is very helpful in especially in the management of chronic diseases. So moving on to the next solutions that are like used for these technologies. So if we use all these AI powered technologies, mainly they are used for like diagnosis of diseases. Maybe it's cardiac arrhythmias or maybe sleep apnea, but not just disease diagnosis. Some of these technologies can also be used in healthy patients or healthy population for general wellness or continuous health monitoring. Apart from that, these solutions are also used for general patient monitoring in acute care settings, in critical care settings, and also in out of hospital settings like home care. And they can also be used for the follow-up or long-term care and to provide a more better chronic disease management. So these technologies have applications across the chronic pathway, across the patient pathway. So I like to highlight some of the important remote patient monitoring devices that are developed and that are growing fast. So one of them is the smart and connected devices. So these devices may be something like a smart thermometer or a pulse oximeter, which is like connected to a mobile application via Bluetooth or Wi-Fi. And adoption of these devices has been rapidly increased over the past couple of years. Then one area of device which is rapidly growing is the wearables, and we have wearables like smart watches, rings, cardiac patches, and a couple of other devices. We even have hearables which are growing, and they are helping in monitoring and tracking various diseases, be it in and helping in early disease detection. Then new technology is emerging, and that is the contactless wireless monitoring solutions. So it covers sensors that are attached to a patient bedside, and they help in patient monitoring. They also monitor various vital signs of patient movement, which enables patient monitoring as well as hospital at home programs. And another new technology is emerging, which is a video-based vital sign monitoring. So what this technology do is it consists of a mobile application, and it enables the clinicians to measure various vital signs via the camera of a smartphone. And there are a bunch of companies emerging this area as well. So with a couple of monitoring technologies which are using various AI-powered algorithms, the care is getting smarter, and we are able to provide a more personalized, continuous monitoring care to the patients, which in turn is improving patient outcomes in hospitals as well as the out of hospital settings, and also like helping the hospitals to reach their operational, financial, as well as clinical goals. So that was a brief overview, Anand.
Thanks, Utkarsha. I think to sum up, these technology advancements are enhancing and becoming integral to care delivery, be it within hospital or at home, and also in terms of managing chronic diseases, right? So, but let's jump right in now with the panel. I would like to invite, maybe starting with the healthcare solution providers to hospitals and healthcare systems, both Emphasis and also Cedar Gate, in terms of to understand their perspectives on how are the emerging market dynamics reshaping care delivery. To start with, so let me start with the first question to Ijaz. Given the healthcare challenges driving the need for transformation, and how do you think the patient care or healthcare delivery models, which are adapting to the converging technological innovations in digital health, genomics, wearables, and RPM and other technology areas? So what's your view on that, Ijaz?
Anand, very good question. This is very clear, not only on the care delivery side, but the entire healthcare ecosystem is going through this shift, right? That is, first thing is very much obvious that now the entire ecosystem is shifting from episodic care after the sickness care to more preemptive, proactive care side. So that's one of the things that is obvious, and it's not only on the care delivery side, it's on the payer and the health insurance side, it's on the the patients and the consumer side as well. At the same time, our consumers are getting much intelligent because of all the AI, because of all these wearable tools, because they know more about themselves than ever before. So on one hand, the care delivery is getting shift towards that. The other hand, the health insurance companies are now, in fact, providing wearable devices. One of the health insurance companies provide Aura Ring to every single member who registered with them, so that they can collect more and more data on their side. Similarly, the the consumers are already have so many devices, so there is no shortage of any more data that ever before, right? We now have much more data and very personalized data for every single, whether it's a elderly population or a younger population. We all have much more data. The question is, can we process that data faster and better, faster and cheaper? And with the help of AI, with the help of quantum computing, and with all the compute power now that we have, we can process them much faster, especially with the generative AI, especially with the agentic AI. We can build new agentic twins, digital twins for doctors, digital twins for the nurses, digital twins for every, the individual, and have these process much more faster. And that's the shift we are seeing across the board, across the industry.
Thanks, Ajay. Those are wonderful points. Being a data and analytics, solutions provider, Cedar Gate, Raj. So how do you view this, right?
No, I agree with Ajaz completely. I think, the rising cost of care is impalatable. Increase in technology has been substantial. Not only AI, big data, but also the cost to implement technology and the barriers to entry are substantially lower. The promotion of interoperability. We're exchanging data, creating one longitudinal record across multiple data sets, not just EMR, not just claims. I get 401k data. I get a lot of behavioral data, socioeconomics data. But the most important thing I think that's driving change in the delivery system is a change in payment model. What we are seeing is payers and providers enter what you call a value-based care contract. And what is a value-based care contract? Instead of paying a provider for a surgery, you're paying them to treat an episodic care. You're treating them to care end to end, from a start of a knee procedure, should they even have the knee procedure, all the way to 60 days after. You're treating a population, a member, across a whole year, right? And once you do that, you really want to, if a provider does that excellently, they can share in the savings. They can become a center of excellence, and the patient can also receive excellent care. By changing these economics combined with technology, you can really incentivize adoption of these tools. What becomes important? I need digital health. I need genomics to get them on the right treatment journey. I need remote monitoring so I can understand what's going on in the point of care, not retrospectively, not 6 months with claim lags, right in the flow of care. And that actually means that hospital systems might actually need less beds, less fixed assets, and to focus more on prevention. You need more genomics, more wearables to identify risk factors, and systems that adopt this philosophy, which is tough when you're going through this transition, will really succeed. And that requires transformation. That requires transformation on your infrastructure, on how healthcare is delivered. And in some cases, you might align to less beds and more virtual care, more outpatient clinics, more membership, not more procedures, more membership. And that's going to cause this transformation and adoption of technology. But I do think it's that economic alignment that's really going to drive that kind of change.
Excellent point, Rajat. Now, continuing with that, evolution of healthcare infrastructure. Now, how do you see that, as the care delivery, shifts more from hospitals to retail clinics to homes and virtual settings? Now, how do you see the role of hospitals, evolving in this paradigm?
I see it completely what Sagar mentioned. It's a move from treating procedures and conditions retrospectively and more reactively to treating populations and patients end to end, requiring all the information to be known 360 on that member. And when you treat the patient holistically versus treating patients, you really have to transform what were cost centers, become revenue centers. Let me give you an example of that. So in today's world, in a fee-for-service world, people are not incentivized to send people home to clip elderly diabetics' toenails with dementia, right? It's a cost center, it's a cost. They would have to pay someone to go out there. They're not getting reimbursed for that. But in a value-based environment, you're incentivized to avoid unnecessary care, to proactively intervene, to have a predictive model that senses that's coming if you can. And if you do so, you're rewarded. You become a center of excellence. You should have more employers in the market wanting to send you patients. You should attract more membership. Another example is, if you're having a procedure, sometimes, it's better to get your body mass index down to a certain manageable level before you have any procedure. The outcomes are better. Right now, this is not rewarded. So I think in the future, hospitals are no longer going to focus on building out those inpatient beds. They're going to focus on building out the outpatient clinics, the virtual care centers, and the home health interventions, treating more patients on that same fixed asset base and keeping people out of the hospital and being incentivized to do that. And that will be the biggest driver of this change. And that will require investment away from things people are used to, large surgery volumes, Da Vinci robots, all of those things will be valuable, but you might have to shift a little bit more to the preventive. So satellite clinics closer to populations, virtual care to intervene when the procedure is needed, AI to figure out how to navigate through the care journey. But what I'm excited about is I think the role of the hospital will be more integrated, will be more about managing that patient end to end, and they'll have a more important role, but they will have to adapt to these new technologies and coordinate those technologies with the brick and mortar strategy to develop that excellent care paradigm, which they're equipped to do. They have the people, they are mission driven, and they actually kind of can operationalize better than most in that delivery, in the flow of delivery. So I'm excited about the opportunity for the hospital system of the future.
Excellent point. So yeah, again, we touched upon various aspects of the challenges as well, but talking about the interoperability mandates which are accelerating. So how must IT leaders redesign their core stacks and to enable, say, seamless secure care across multiple settings? As Rajiv, you mentioned that across different areas of care delivery. So I'd like Tim to kind of share his views on this aspect as to how should the tech leaders and IT leaders kind of look at the redesigning of their core stacks.
Yeah, sure. Thanks. That's a very valid question. So, maybe as evidence of my gray hair, I can look back on conversations that have, excuse me, been going on for many, many years. I think I pulled up a presentation I did back in the 2000s, and the topic was data interoperability, right? So, I mean, this is something that obviously in healthcare, whether you're talking about payers, providers, all of those sides, data silos, data integration, something we've been trying to solve for a long time. But important, and I think an important part of the question you asked is really, how do we accelerate that? How do we work now to look at the fact that that requirement is accelerating, right? So we've seen a lot of movement, I would say, over the past 5 years, even in this data integration and data integration standards, where we've been able to move data from silos and share that data. But I think the first thing that IT leaders need to do is to understand what they currently have, right? Because most of the time here we're talking about a transformation, right? So we have to continue our operations, we have to continue what we're doing, but we need to transform our systems to support the model that Rajiv was talking about. So that in itself used to be a huge effort, right? Just a data transformation assessment, data transformation plan might take a year to develop, right? So now when we look at the AI tools that are utilized, that can be brought down to several months, right? So identifying what you currently have, what are those systems in place that are not digitally enabled or are causing you sort of a tech debt issue, are identified. And not only that, but the AI mapping out the rules and the future plan for that type of transformation. So those systems that are not going to support that, they either need to go immediately, or there needs to be a mitigation plan set out for those. So I would say that's kind of the first thing, is sort of know what you have. And then the second is really knowing what you need to achieve. So you have to look at it in two different ways. Are you really trying to achieve, system integration, or are you trying to achieve data integration, right? So if you look at kind of those as two separate things, they serve separate goals. So obviously from an integration standpoint, being able to receive data and provide data back to those that are giving care, as an example, or through the wearable devices directly to the member, right? That's going to require a lot of data, but real-time integration with data, operational data, all of that, to be able to do that. So we have to look and make sure that those systems provide that interoperability. And there's already, HL7, FHIR, HIE systems, and there's all of that is beginning to accelerate. So I think IT needs to look at all of those opportunities. Now, the challenge of this really also that needs to be looked at is on top of all of the HIPAA and all in the US, the HIPAA requirements, the other data privacy requirements and regulations. You have to look at those. So obviously the role of the data officer, the data privacy officer within an IT organization becomes very important. But you're facing the need to share that data with also regulations that inhibit you from not sharing certain data, right? So it's a big challenge there to be able to manage all of those things. So I think IT has to look at that in that sort of holistic view. We're still in a big challenge there. I'd say 80% of looking at different studies have shown that 80% of healthcare data is still siloed, still unstructured, siloed and unstructured. So moving that over the next 5 years, the advent of these technical tools is going to enable that and enable that to accelerate.
Yeah, thanks, Tim, for those. Yeah, go ahead, Ejaz. You wanted to add something there?
Yeah, actually, what Sagar talked about, decentralized infrastructure, and what Rajiv talked about earlier, and Tim said, is along the same line, right? For us to be more in a decentralized structure, interoperability is much more important, right? That's the only way we're going to have a centralized data with the decentralized infrastructure as well. And what it's going to do is, with the power of AI, with the power of data and analytics, we can convert that data that we are real-time collecting from all these different places and different sources into more insightful information for our providers and doctors so that they can take the right decision, right? That's the ultimate goal is. So before something happens, the doctor and the hospitals and clinicians should know what's going to happen next, right? At least to that level, we should be able to provide that information. And that's where interoperability comes into play. That's where the data and the analytics comes into play. That's where the entire ecosystem and how the ecosystem works together, that's what is going to come together. Right?
Yeah.
So that's the outcome that we are looking for.
Sure. Yeah. Thanks, Ejaz. Now, we also discussed about the smart hospitals and the infrastructure transformation that's happening, right? So in smart hospital projects, I'm sure that Raj, would have been working with many of these hospitals. Now, how do you see them balancing their investments in terms of brick and mortar versus the digital capabilities, like say IoT, analytics, and also in terms of AI-driven facility management? So how do you see that happening across this area?
That is a great question, and it is a difficult position to be in as you make this transition. I have a benefit because I have a startup background. Cedar Gate is no longer a startup. We've grown to over 1,000 people. But I also started my career in an investment background, so I have a heavy financial background. And at Cedar Gate, I get to work with 450 hospitals, 33 large payers, and 90,000 self-funded employers. So I get a mixed bag, but all markets are kind of converging. But when you think about that hospital, I think they need to think about their core strategy and who they want to be. Do they want to be a lead virtual strategy? Do they want to build centers of excellence around procedures? Do they want to become a center of excellence around care management and chronic disease? And then they need to align. You can't think of these separately. Align the brick and mortar, the digital, the analytics strategy holistically around this. Now, it doesn't have to be everything. It's not like you change the whole hospital, the whole program at once. You can do this within a service line or an episode of care. Let me give you an example. If a hospital wants to be the best in cardiac center in their catchment area, you can, they want to, have a system that has low rates of unnecessary cardiac surgery, low waste in terms of labs, low value care, high patient satisfaction, good outcomes. And they want to be a center that employers are lining up the doors to send their patients there because they have good value and good outcomes, and their patients feel good about going there. Well, how do they get there? First, they need to use analytics. They need to understand, where do they have low value care and waste? Where do they have bright spot doctors or care delivery systems that guide the patient with high consistency on a risk adjusted basis through the care journey? How do they implement what those bright spot doctors or care delivery systems are doing across clinical protocols so they can scale it across and incorporate AI to do that, to avoid, automate where appropriate, human in the loop automation. We have clients that do this using ghost or phantom programs where they're looking at the data. They haven't implemented a risk-based program yet, but they're seeing how they would do. But when they get into those programs, they know exactly what levers to pull. Step two, they need to align the brick and mortar and the virtual care strategy with this. So if they're creating that cardiac unit, are they creating a unit like around digital health to preemptively manage and around the wearables and proactively manage the patient at home or virtually? When a procedure is needed, is their brick or mortar optimized where the scheduling is optimized, the Internet of Things helps to avoid, create efficiencies and helps to avoid infections? Are they using all of those things to, think of the world-class system around a given episode or service line? And if they do that, they can really, holistically within these areas transform their organization and over time transform everything over and become that center of excellence. And if they do that, I think they will cross that chasm and they will see a lot of benefits financially, and patients will benefit because they will have that system optimized around the right things. So that's how I would look at it. It's hard to transform your whole organization, but if you start by what you do well and you look at service lines, there's ways to adapt all of these things in the right way that gets you to the right objective and get patients to the right place.
Yeah, thanks, Raju, for those perspectives. Now we've heard, perspectives from the healthcare solution providers. Now, from a healthcare provider, Alberto, I would like to understand as to how you see smart hospitals generating, the vast amount of IoT and digital twin data. Now, how do we turn, this data into, say, measurable value in terms of value-based care?
Thank you. Indeed, I will build upon something that has been already said. Here, the key point is the demand side, because the ecosystem is ready to re-engineer and deliver those new services because the whole ecosystem is there. What is really missing from a provider perspective is the demand side. So we have either in a public system, as we usually have here in Europe, or in the private system, if there is no demand for the services, we are not in the position to deliver these services. And so this is a critical point on the policy level rather than on the technological level, which is the point, because we all know and speak about this, but it's a point that can be solvable if there is an alignment of the business models. And this is the key point. Waiting for the world to change and to embrace this approach, what an hospital can do is to optimize the internal costs, because the internal costs are in your total control. For example, we made several projects dealing with robotics to optimize the logistics for pharma and medical device and using appropriately resources for whatever protocol it is. But for example, the cost of logistics and the cost of energy are really money that you can save with your control. And so the distance between your cost and your delivery can also generate margins to make you invest in some transformation and pushing into the market some, I would say, subsidized innovative services to grow a private market around this, in the waiting for the big insurances or the big state or regional public authority to understand the ecosystem value and change their payment policies.
Sure. Yeah, thanks, Alberto, for those views. And before we move on to the next session, next section of questions, I'm going to let Julieta launch a short poll. All right. Yeah, continuing with our conversation, with Alberto, the use of AI-powered remote patient monitoring tools for preventive care, which we discussed earlier. Now, where do you see these, future growth opportunities, from wearables and connected devices technologies, and also the chronic care disease platforms, which offer, in terms of enhancing the chronic care risk reduction?
We have available such a huge amount, as has been said, of IoT, and above all, together with IoT, we have edge computing, because without an architecture based on edge computing, we could not manage a distributed system in a proper way. Because remember, we are in a safety critical market, and latency is an issue. It's a liability issue. It's an healthcare issue. So it's very important that we consider the architecture in general terms. And what I would like to say that it is indeed very fragmented, the transformation in very specific verticals of care. So if you consider singular pathologies, because then you have to generate a system that responds to a niche of the healthcare needs. And this is the vertical approach. As a complementary strategy that is also, let's say, connected to what I said before, you can have an horizontal strategy in which you are enlarging the ecosystem, providing consumer health and well-being services that are directed to a wider market. So, for example, you can include nutrition, which is not something that hospitals deliver as a lifestyle business, but includes the food and beverage business into the healthcare system driven by healthcare providers. So it is important to complement a strategy which is vertical for pathology and critical to a strategy which is horizontal for well-being and consumer, because so you can compensate, you can create a platform and you can compensate and have revenue models that are able to enable your own transformation in this direction.
So moving on, and in terms of the use of AI, so how do you, Raj, and this is a question to you, how do you think that AI can be leveraged to analyze and interpret the vast amount of patient data generated by digital solutions for proactive chronic care?
No, I think right now, as many people here described, there's almost too much information and too many interventions to work on. So if you take what we do at Cedar Gay is we do take all that information in, and we do have predictive models to take that disparate data and try to identify, who are the right people to intervene with, who would be the most likely to, be eligible for a particular digital health program, or who's at risk for a high cost event. What's the best method to engage? And these are all algorithms that are built off of, we have 60 million lives in our platform, so we can kind of use that data obfuscated to predict these kind of things and then make them valuable and apply them to individual customers who might not have the density, who might not have the enough volume or the variety of data to make those kind of models. Now, once you to I think evaluate care manage, and all of our clients are being inundated with digital health solutions, whether it's Hinge Health or all these different virtual care programs, or they have their own care management programs. We can now take that information in. So new data sets like exercise counts, wearable data, patient satisfaction can all be incorporated. And I think if we can use the more modern tools to identify the patients that are most going to be positively impacted without bias by these tools, link them with the right strategy or digital health strategy, leverage AI tools and other things to help nurses and physicians, optimize and manage the outreach. Because, right now, the cost to do that with many nurses to engage is too much. So AI can be helped with human in the loop to do that at scale finally. And then the last thing is to monitor the return, right? Is this actually effective? When you have so many entities interacting with members, it can be difficult to determine what's actually impacting the member for the right outcomes. So you need analytics to understand that and monitor that, what's effective. And if you can do that in a continuous learning loop, you can get better and better and better at care management. I think there's a strong opportunity. 80% of all of the cost of hair is because we're not managing it. But it does come back to what Alberto's saying. You should also invest in broader plans like getting healthy in your 30s and 40s instead of waiting till you're 50 or 60, right? So it's a combination of using these tools, but also I like Alberto's approach as well.
Yeah. Just said, we posted the poll on the challenges. So we got to know that about 63% of the participants feel that the lack of interoperability and misaligned reimbursement models are the biggest challenges that they're facing. Interesting. Ijaz, what is your take on the use of AI and how it can be leveraged in terms of chronic care?
Yeah,
Providing
before
chronic
I go to
solutions.
before I go to the AI part of it, wearables and IoT devices been there for at least good 8-10 years now. I know we have pacemakers for patients that can text the physicians and clinicians in case of negative impacts or negative health of the patients and so on and so forth. I know we have Auras and Apple Watches and Fitbits and all kinds of devices getting the data. But the ultimate end result that we all want to achieve is, again, the preventive care side of it, that you doctors and clinicians should know before it happens. For if you talk about the epilepsy patients, before they have an epilepsy episode, the doctor should know that this should about to occur, right? Those kind of end result that we are trying to get to. And to get there with the, again, as Sagar mentioned, or Rajiv mentioned, and as Alberto mentioned, we have the data. We have to process it better, faster, and cheaper. That's one of the key things that we need to do. And we have to, if we have the better predictive model that can, predict before something happens, then we are on the success path. And that's what's going to happen with the help of the AI and the agentic AI. And that's what, at emphasis, that's what we are trying to do. Build those kind of agentic human, digital twins for you that can do that kind of job without the help, at least, and then these agentic agents will be autonomous. And then the human in the loop, which is the physicians and the nurses, can take that information from the agentic agent, which is processing much faster than any human, can do, and take that and then say, this is to take a second opinion. And of course, we have things like open evidence, and other specific, LLMs that now are available. So again, the agentic AI, the conversational AI, all comes together to deliver the better, faster, cheaper solution and care. And it's more of a preventive care rather than the after the episode care. And that's where we are heading.
Yeah. Thanks, Ijaz. So I'd like to also, get Tim's views on, how agentic AI, can improve remote patient monitoring technologies and care delivery.
Yeah, sure. So a couple of things on that. One, I think, is this, sort of really the speed at which the monitoring, as an example, and data can be consumed in the past. And in fact, when you talk about the data interoperability and silos, one of the problems to that is the speed of getting diagnostic information, in the right hands, having to have a human read that information and then interact with the patient in a way that you don't know whether or not that's effective or not, right? So with AI and some of the things they just talked about from a predictive modeling standpoint, now we can do predictive modeling, interact with the patient, look at their adherence to the interactions that are being defined, see if those are bringing out changeable results. Alberto talked about things like bringing in, wellness and food and all of those things. So being able to analyze all those data points, at a single moment in time, in real time, and being able to determine how to interact with the patient to adhere to those measures in a way that is effective to them. I can see that, it's sort of one of the biggest things from AI, and that's allowing a lot of the things like Raj talked about. You've got centers of excellence now that can, manage those. Whoever can build those predictive models and care plans that are most effective, right? They'll bring down cost and increase care, right? And that's going to be done through all of that AI. So now we can monitor a patient, identify a care plan, adjust the way that we interact with them, identify, issues that are outside of just the clinical realm to bring about that wellness.
Yeah, thanks, Tim. So we did talk about the opportunities, but Raj, quickly, if you can just, from your experience in working with healthcare providers, what do you think are some of the challenges that you see in future of care delivery, and how do you think that these healthcare providers can overcome them in the next 5 years?
I think, like, as everyone mentioned, AI is a huge opportunity. in healthcare, but the one challenge is that healthcare's bar is a lot higher than other industries. In other industries, you might be able to be 80%, 70% accurate. In healthcare, you really need to be 90, 99% accurate, especially if you're going towards any patient decisions. You need to be really confident. The other issue is privacy is critical. Like when we have patient data, we need to be sure it's not going to the foundational model, right? A lot of people are wrapping AI with the large language model, but that data, you can't really, especially patient data, cannot go back to the foundational model. You need to actually create the infrastructure so you're doing it, and separating the prompts and all of those things. AI needs to be interpretable. In healthcare, it can't be a black box. I can never show a physician just a 0.9, hey, this guy's at risk. Why are they at risk? Tell me the exact things. And it can't have bias. We cannot unfairly, present an opportunity to one population or one demographic. And the last thing that I think people are missing is healthcare is personal. We cannot blindly replace humans with automation at every step. We do need to, though, use AI to make humans more impactful and vastly more productive. So I think, what you need to do is design an AI system, which we have, that all the data is separated, nothing goes to the foundational model. 2, make it interpretable. Every insight can be explained. Number 3, anything that touches a patient needs to be human in the loop, validated, and have confidence in. But if we can do that, now the goals we've all talked about become a reality, because before we needed humans to do that, and that was impossible. So these are the challenges. I think they're overcomable, but we need to build trust over time and build things in the right way to promote adoption.
Sure. Before we wrap up, maybe if all the panelists can share one trend or probably a growth opportunity that you see in this area, starting with Rajiv.
I think it's the combination of being rewarded for excellence and AI in tech. If we reward excellence, we can incentivize people and give them funding to transform. I think AI will initially focus on those administrative tasks, but in the future, it will be promoting efficiencies everywhere, and we will get to excellence, and we'll have a system that rewards excellence. Now, that won't happen overnight, but trust will be achieved, and over time, that payment model alignment combined with technology, I think it's achievable where we can have a system that will evolve and enable more excellent care for kind of everybody. So those are the 2 things that I think are the most.
Sure. Alberto, maybe if you can share your thought on the trend or growth opportunity.
Yes, I think that the biggest opportunity that we have in front of us is consider that we are in a behavioral economy, and health is based on lifestyles. Now we have a huge amount of fragmented pathologies because of lifestyles, and that is all the discussion that we have. So if we can enlarge the ecosystem, enter in the behavioral economy, providing primary prevention, real-time services at the point of sale and the point of decision, here we'll have the biggest market ever and the transition done from the bottom, and we will have a future of healthy environments and healthy citizens.
Thanks, Alberto. And maybe quickly, Ajaz, if you can add your thoughts on one trend or growth opportunity.
Yeah, very quickly. First of all, I agree with Rajiv and Alberto both what they just said. But with my technologist hat, one thing I am looking forward to is the combination of robotics and the AI. And I'm waiting for the day to, I hope I can see that day where the robotics and AI comes together, and that will be the game changer for the whole click care delivery model. That's where nobody's saying, that we will replace the humans in this, healthcare ecosystem, but it will improve their productivity of our clinicians and doctors and nurses. That's the ultimate goal, and we reduce the burden on that. So with the combination of robotics and AI and with data, powered by the data, I think that will be the game changer.
Wonderful, Ajaz. So fantastic. And also with that, I think that I'd like to close this call. Really appreciate everyone's time and investment in today's discussion. It was, fascinating to get the perspectives from both healthcare provider as well as healthcare solutions provided to hospitals and healthcare systems. So, and clearly, that there are multiple opportunities, right? And but at the same time, there are risks to be managed, and as we go through these transformations, so those we need to keep in mind. So again, thank you for joining for this discussion. We will also have a series of additional growth webinars planned towards the rest of the year. And I look forward again to you all joining in those discussions as well. Thank you.